Hello and welcome. My name's Elana Gordon. I'm a reporter at The World covering global health. This is a live Q&A about the coronavirus pandemic and the mental health impacts of reopening society. My window is open. Apologies for the background noise as it's very hot in my apartment. Joining me is Karestan Koenen, a professor of psychiatric epidemiology at Harvard's T.H. School of Public Health. Karestan, this is, I think, our third conversation in this pandemic, so thank you so much for joining us.
Oh, thank you. Nice to speak with you again, Elana.
And I'm really looking forward to it. And for everyone tuning in, you can post questions for us on Facebook at Forum, HSPH, or you can email them to the forum at hsph.harvard.edu. This Q&A is jointly presented by the Forum at Harvard's T.H. Chan School of Public Health and the World from PRX and GBH. Karestan, the pandemic's affected nearly every aspect of how we live, how we work, how we play. Some impacts have been visible, mask wearing, social distancing, but many things aren't, like the psychological toll. In the US, we've moved from fearing a virus that has left more than 600,000 people dead to having a vaccination and campaigns that provide some hope that we might return to some sense of pre-pandemic normalcy, at least in this country right now. Of course, the global rollout is a different story. So to begin with this conversation about the mental health impacts of the pandemic and reopening of society, are we fooling ourselves right now as we try to move into this post-pandemic phase right now? How are you viewing this given your lens of looking and studying at mental health?
Well, thank you for the question and for covering this. I think one thing from my personal point of view, it's been really, I've studied mental health and trauma and post-traumatic stress my whole career, but it's such a different experience studying the thing that you are living through yourself. Mm-hmm. So a lot of it, through my own experience as well as research. I guess the way I like to think about this time when you say, are we fooling ourselves, is that we've all gone through a tremendous amount of change and stress this past year with all the things you mentioned, and lockdowns and changes in the way we work, live, every aspect of our lives. And now we're being asked to change back. People are being told to have been home. You have to go back to work. Often many companies have recent days set. Even people who've had to work through this out of their home the whole time, other aspects of their lives have changed in terms of whether it's around seeing family members or other kinds of activities or things that their kids are doing. So it's a time of tremendous change, and it's good to remind ourselves that all change is stressful. So even in what I call the prior times before COVID, just things like getting married or buying your dream home, or if you've ever moved to a new job that you're excited about, even those things are tremendously stressful. So it's not about so much fooling ourselves, it's just being aware that we are going through all these changes, and it'll impact all of us differently, but we all will experience some kind of stress on top of what we've already experienced this past, 16 months now.
So this is a stressful moment.
A stressful moment, yes. Even if it's a good moment, it's a stressful moment.
Is it a momentary stressful moment?
That's a good question. I think, no, I think it will, the change, because we've been experiencing COVID for 16, 17 months, depending on what part in Massachusetts, it's definitely been since early March. And we've sort of adapted in whatever way we have. It's going to take time to get back. So I would expect it to be sort of the change and the stress will last. So for example, because now we're in the summer months, but we'll be transitioning back to school, which will be another, for example, for kids. And that will be another, all the schools are facing, well, what do we do? We're in a different period. How do we change things? Which means there'll be changes on kids and parents and teachers. And so that's just one example of how this will be ongoing. Workplaces have adapted and are trying to figure out what to do. Camps, families planning get-together. So I think it's not something we can turn around overnight, for sure.
Mm-hmm. I want to ask about kids, actually, to kick things off. Children and adolescents have experienced really specific challenges during the pandemic. as you were saying, from school closures to a loss of play and social time. A recent brief from the Kaiser Family Foundation found that more than a quarter of high school students reported worsened emotional and cognitive health during the pandemic, and that LGBTQ youth and children of color may be particularly vulnerable. How do we help people and children in particular, and how has your understanding of these impacts evolved over the pandemic?
That's a great question, and I wish I had all the answers. But
tell us everything.
So a couple of things we've learned over the pandemic is, while sort of we were very focused, which made sense, and in public health and elsewhere on the virus and protecting ourselves from the virus in different ways, whether it's wearing a mask or staying home, or in the beginning disinfecting everything. In terms of people's mental health, what people report, the biggest impact are things like the other stressors, their experiences, which are almost like the secondary to the virus. So it can be things like, exactly like you said, schools being closed, changes in economic circumstances, changes in, other like childcare for parents and things like that. And I think that is something, similarly, that's true for kids. I think as much as education has really tried to step up and offer online and tried to adapt, I think what we've learned is there's really no replacing in-person contact between kids and teachers. And that, in many places, especially our public schools, were inadequately resourced to really meet all the challenges. And I don't have all the answers in how we can address this, but one thing I think we have to be careful of is one can't ignore it and just sort of pretend like kids haven't been affected, and that even if the older kids are vaccinated, that everything's fine. And the other thing is, we can't just expect the schools to deal with kids' mental health without additional resources to do so. Nor leave it to parents to sort out. So one would expect increased need for sort of special education services and things on the learning side, but also what's available on the social-emotional side for supporting kids and parents. And that differs from school and district, but there's going to be a big need that has to be addressed for sure.
I want to, as we're having this kind of general part of the conversation, and many questions have come in from listeners already, but just moving to adults, there's been reports of lots of people leaving their jobs, about health workers, especially burning out from all of this. What are we learning about the pandemic's impact on work and how that breaks down?
Yeah, that's a great question. I think one of the things we're learning is that there are especially we've noticed in healthcare, people burned out and feeling part of burnout, or in general feeling perhaps betrayed by institutions they work for, unappreciated, whether financially or just that they weren't their contributions weren't acknowledged, and people also reevaluating work in terms of, maybe that job wasn't worth an hour and a half commute each way, or I want to spend, more time with my family, or things like that. And so it's really causing people to reevaluate work, which, for some people can be a good thing. But I think at the institutional side, employers need to think about, institutions need to think about how to address some of these issues. And one is that people are going to have to so in terms of going back to work, if you're transitioning back, in terms of transition, institutions are going to have to deal with the challenges employees face. And then I think around burnout, how can institutions, for example, are there policies, and I'm not an employment policy expert, but are there policies that can allow people to have adjusted schedules or leave time, or allow people to keep their jobs, but recover if they are burned out, or have time to transition back to new expectations? And I think that, we've learned during the pandemic, something that's been positive is a lot of things we said we never could do have been done. Just in, for example, in mental health care, people have been trying for years to get reimbursement for telehealth, equal reimbursement for telehealth. That people have been trying to do that for years. Couldn't be done. Then suddenly overnight, with executive orders, at the state level, it's telehealth reimbursed. It's been incredibly successful. There's a lot of evidence that for mental health services can be provided through telehealth effectively. So I'm sure there's many other things that workplaces and people have done that have worked. And I think it's time, maybe we can take this transition time to think about, well, what changes, what are the things that we thought couldn't be done that we've done and that have been successful? And maybe there are changes in workplaces. I think a lot of workplaces are thinking about more flexible schedules, things like that. So things that can be done going forward. But one thing I want to be careful is to put this on the institutions and not just tell people, you're burned out, go take care of yourself, but you still have to, work 12-hour shifts 5 days a week.
It makes me think of places like Spain that are trying 4-day work weeks as an example.
Right.
Which leads me to one thing I wanted to ask before we really dig into viewer questions and listener questions, which is you're a global health researcher on the pandemic and in particular on pregnant and postpartum women and how the pandemic is impacting post-traumatic stress. Sorry about the background. Depression and anxiety and other issues around the pandemic. Could you tell us about what you found with that, what you're learning about the pandemic and particularly impacts on women and pregnant postpartum women?
Sure. I was lucky with a colleague, Diego Wazinski from Registry, and a colleague from Harvard Chan, Sonia Hernandez Diaz, to do a survey of pregnant and postpartum women globally and on their mental health and well-being and what was on their mind. And I think the thing that was most striking to me was that the women wrote in comments, which caused us to change the survey. And the comments were a lot about the other stressors they were experiencing in addition to COVID. So the things that we found most associated with their mental health in depression, anxiety, post-traumatic stress, and also loneliness were economic challenges and challenges with childcare. And then also because for pregnant women, shutdowns around healthcare were also very stressful. So not being able to go, there was lots of changes around healthcare and prenatal care and even pregnancy, birth and delivery. And so it really kind of spoke to the broad range of effects of COVID, but also the need for policies to address sort of economic security, childcare, and again, adjustments in healthcare that need to be made because of the virus, but how that might impact women's mental health, not being able to go to your regular prenatal checkups, for example, and not having a partner at delivery. Those were very distressing for women. The other thing that was really striking, and having done work in global mental health my whole career, I've never experienced this before, it was how similar the problems women were reporting across the different countries. So we had 64 countries represented, but the countries with the most participants were the US, Mexico, South Africa, and China. So those are, obviously very different, but the things that women were writing about were very similar. And also their level of distress was very similar. So that was really striking because usually when you study something, I study earthquake in Mexico, you're studying something that happened in one context, but in this case, it really captured the global experience of COVID.
You mentioned a little bit about structural. It makes me think back to an earlier conversation that we had about kind of the intersections also of mental health and some of the structural and even policies that governments and communities can be thinking about. And you had mentioned employers earlier. What are you seeing when it comes to these sorts of things?
Well, the exciting part is you're seeing a lot of innovation. I think that I see, so at the employer level, there's lots of employers doing surveys of employees and really trying to figure out employers that would have said there was no option ever to work at home or something, to figure out what, how it can work, what people want, how to reimagine workspaces and things like that. And then I see there's been a lot of great state level work on policies around, again, some of the things in Massachusetts have been around reimbursement for telehealth. But I was talking to a group in Indiana who got funding for crisis lines. Mm-hmm. So I think there's been a lot of local and state level innovation. And what I personally would like to see is more leadership at the federal level to make mental health and the mental health effects of COVID a priority at the same level as concerns about variants or other aspects of the virus, because I really do think it needs that national leadership as well as all the leadership we have seen at the state level. So there has been a lot of innovation, and it'll be really interesting to see if people can carry that through in the hopefully post-pandemic times.
This it might be a good transition into this question from Lexi. There's a ton of really great questions here from viewers. I know I keep alluding to that. Some of them you've been getting at, but what stresses or mental health impacts might be associated with those who are unemployed, especially as unemployment bonuses run out soon?
Yeah, so we actually know, I did some work, and other people did work too, during the 2008 Great Recession, which showed that things like, for example, we found that home foreclosures, people who had foreclosed homes had increased risk of even if they never had anxiety or depression before, having an anxiety disorder or depression. So economic stressors, we know, impact mental health, whether it's losing income of some sort or losing your home. So we don't usually frame it like this, but policies that provide economic security and stability and make those investments are actually good for mental health and could be seen as mental health interventions because it's there's just such a direct link, as you can imagine, the stress from not losing your job, and then it has all these downstream effects. Stress of parents of losing their jobs then affects their kids, which then probably affects their kids' mental health. So there is this very strong connection that we often don't think about when we think of economic interventions or economic policies.
Are you saying we often don't think about it, but we should?
We should. Yes, we should. More. I think of economic policies. They can be thought of as mental health policies, as policies to affect mental health or improve mental health.
But this question comes from Mark. What actions are in place to, quote, pick up the pieces in this crisis? For example, will there be mass public education or treatment?
That's a good question, Mark. I think so part of that is why I would like to see more leadership. And there has been some, but really public leadership at the federal level. I would love to see the appointment, like we have sort of a climate czar, a science czar, mental health czar, whatever you call it, who could investigate and maybe provide some national leadership on these policies. In terms of where I've seen leadership is at the state and local level. Some of the things I mentioned with states setting up crisis lines, setting up, making changes to policies to increase availability of services. Also, and employers doing that. Employers have offered that, but it's a little bit left to the individuals and the communities and whatever institutions they're attached to. So that's why it would be great to see more leadership at the national level for some of the things like Mark mentioned. I think public education, not everyone needs even if people are distressed, they may not need mental health treatment, but there may be other supports that could be provided that would improve their mental health.
This question comes from Ian. It's about the Delta variant, which is circulating. We've been hearing that we may be asked to start wearing masks again. I know this is an issue, for example, in messaging in LA. Of course, globally, the situation is different as well. So how do you deal with feeling like we turned a corner and then to have something switch or go backwards, potentially?
It's really hard. It's really hard. I think that that something So one of the reasons this year has been really hard on mental health, or one of the many reasons, is that, uncertainty and uncontrollability and threat, which we've all experienced with COVID, are really tough on mental health. We like to feel like we're in control. We like to feel like we can predict the future. And we kind of all operate like that in our lives. And I think with the challenges that we all are going to need to live with a certain amount of uncertainty. And that's okay. We actually do all the time. We just don't realize we do. Something to remind ourselves of, and from a more hopeful point of view, is that we've made it through the last year, and we've all dealt with a lot of uncertainty and a lot of messages. Don't wear a mask, wear a mask. You can go outside, you can't go. You can do this, you can do that. And so what we hope is that the messaging will be more clear going forward, and that we can adapt. We have adapted, and we can adapt. But I think we will have to tolerate a good amount of uncertainty. And as you said, globally, there'll be challenges for quite a while, which means there may be other variants and things like that. So I think it's just going to be challenging.
And accepting that,
which is not easy. As someone personally who likes to be in control and plan the future, it's not easy.
I just want to remind everyone who's tuning in that I'm Elana Gordon, a reporter with The World, and I'm speaking with Karestan Koenen, a psychiatric epidemiologist at Harvard's T.H. School of Public Health, and we're taking your questions. So viewers, if you want to post them. This question comes from Lori. It seems to me that the pandemic has, on the one hand, reinforced bonds within communities. Every time I ask a question, the subway goes by. I apologize.
That's true.
I don't know if it's as loud to you as it is.
Yeah, it's okay.
Okay. Sorry, Lori. It seems to me that the pandemic has, on the one hand, reinforced bonds within communities, but at the same time pushed strangers further apart. Is there any data to support my premise? Like, I found that when I go farther than a few miles from my town, I'm swallowed in a weird depression I've reasoned comes from an unsafe feeling.
Oh, wow. That's Lori's a poet, actually.
Freelance journalist.
Freelance writer. So, yeah, I think the pandemic has challenged in closeness and pushing people apart in and outside communities. And I have a lot of thoughts with this, but I'll try to be brief. One is that it's normal when we're under threat to kind of hunker down and sort of attach to people closest to us, which, may be your family or your building or, people, your neighbors, where I live. And that is really self-protective, and it's almost how we evolve as humans, how we evolved. But so I would say that is kind of expected, that now after hunkering down, when you go outside that, it can feel threatening. And myself, I think I had mentioned when we were talking that there also can be just some unease and almost like grief or sadness because things that were normal don't feel normal or don't feel the same. So maybe you used to go out to this community, something you enjoyed doing a couple times a year, and now it just feels strange, or it doesn't feel like you thought it would. And so that is also just would be expected to deal with. So I think that's part of all the changes that we're all going through right now.
So learning more about this as we all experience it as well.
Right.
It sounds
right.
Like.
Exactly. Yeah. Yes.
This question comes from Beth and following up about schools. Looking ahead to next year, what should schools be doing now to prepare to meet students' mental health needs in the fall?
Wow, that's a great question. Probably should have we could have a whole forum, I think, on kids' mental health in schools. Maybe that would be a whole. So I guess briefly, I think on one thing, I hope all teachers and school administrators are getting some time off this summer. So I just have to say that because I think it's been a tremendous stressor on teachers this past year, having many friends who are teachers and things like that. So what can schools do in the fall? I think that one is around educating themselves and their, as part of their, whatever they do, summer education or teacher development, including some understanding of mental health for students, but also particularly around changes in stress and what are some common, depending on the age group of kids that you have in your classroom, what are some common ways that kids express stress or resistance to change or having challenges with change, so teachers and folks in the school are prepared for how kids might come back, which is going to be very different. Some school systems, where my sister lives upstate New York, it's been open the entire last year, and my nephew's been in school last year, and I expect very little transition in the fall. Well, some kids haven't been in school, and so depending on the situation, really, maybe I would say preparing teachers just to be aware of what they might see. And then also collecting information on resources, like where they can refer families in the community, whether it's community mental health services, et cetera. So what are those resources so they're well connected? And a lot of schools, at least where I live, a lot of schools are connected, but making sure you're kind of update on those connections and you can make those for parents. And then I would like to see this as a challenge for, what could schools be doing better in the future with kids' mental health? How might we want to prepare better for future crises like this? But I think that's a longer term question.
Mm-hmm. This question is, I want to get, we're running out of time, but there's other good questions. I wonder if you have a couple more minutes or if you have.
Yeah. So I can stay late. It's fine.
Okay, awesome.
Keep going.
So, and I'm taking in what you just said, but there's just so many really good questions. This one's from Andrew. Pandemic-related isolation's been especially hard on many people who are older.
Yes.
Is there research on mental health impacts of the pandemic on older adults in particular, and how to provide effective support as society reopens to these individuals?
Yeah, that's a great question. One of the things that's been really striking is when folks have compared older adults to younger adults, is that actually younger folks seem to be having worse mental health effects. And it's a complicated thing to research, which I won't bore everyone with those details, but that actually surprised me. And we find that in our own work.
Wait, how do you define older adults?
So in those studies where usually they look like 65 and over, 70 and over versus, folks in like their 20s or something 30s. So I know my 14-year-old thinks I'm an older adult now. So it depends on definition, but at the same time, older adults were obviously more at risk of getting very sick or dying from the virus, disproportionately, saw usually friends or people they knew died. And we're also, from my own experience with my mom who lived in Atlanta, were disproportionately locked down. So even though where she lived had opened up, her building and everything was locked down. So I think that, where things have been effective is that there's been a lot of efforts to introduce technology. Two things. One is getting vaccines to older adults and, protecting them as quick as possible. That was, I think that effort has been quite successful. So protecting their physical health so they could actually go out in the world. And then all kinds of innovations around technology. We actually have a program I found out in Brookline, which is now matching young people to volunteer to help older adults with technology. This is happening this past year to increase those connections. And then things that would take care of other needs like getting food, like Meals on Wheels and things like how could you adjust that during the pandemic? So that's another area where I think there actually were a lot of things done that people would have said were not possible prior to the pandemic. And some of those we might want to continue going forward. So
this I want to combine two questions here. kind of unfairly, but one is from Dawn, which is that we've entered into phase 3 at my office. And every time I pull into the parking lot, I hyperventilate. How do we adjust to being back? So there's a question about anxiety in that transition. And then this question comes from Jill. Do you have suggestions for people who really are quite happy to be isolated during the pandemic and are now reluctant to have to pretend that they're overjoyed to return to social situations or to work? Shout out to Jill.
Yeah, I would say, Jill, you're not alone. I was telling Elana before that I had friends call me and be, is there something wrong with me? Because, I'm not overjoyed. And some are just reporting feeling very stressed about the changes. And some people, the pandemic, especially people who were very anxious or socially anxious, the pandemic provided a way of basically avoiding or getting out of many things that you might have found distressing. Now, it could have been that going into your office, or it might have been that, you didn't like seeing your family having your family dinner every month, and now you have to again. And so those are real things people are facing. And then, and then Dawn talking about feeling like the level of panic. So I think a couple of things is, one is that, feeling anxiety after not doing something or avoiding something for this, as long as we have 16, 17 months, that is normal for everyone. The real issue is if the anxiety is getting in the way of things you actually want to do. So if the pandemic allowed you to get out of some things that you no longer want to do, that might be something you want to look at for yourself if you can. There may be changes in your life. We talked about people who are willingly changing jobs, or some people are reevaluating. A lot of parents I know said, you don't want to go back to running around all the time like a crazy person. So thinking about that. But if there are things that you do want to be doing, but now you're anxious, then that is something, that is another thing you can work on. So some of the, that could be a whole session in itself, but one of the things is that there are a lot of strategies you can use. You can find them online. You don't necessarily need a therapist to teach you, that can help with sort of the level of panic that Dawn's experiencing. There's something called diaphragmatic breathing, and maybe we can post some resources or something afterwards that can help with those feelings of panic. That specific situation is, you can learn to manage that. And then the other piece is avoidance really reinforces anxiety. So if you're someone who, you do want to socialize, but you're feeling anxious about it, think of ways that you can get yourself to do it that will not be overwhelming. So some of the suggestions I've given to people, like people are invited to a party, they feel anxious, they haven't been to a party in 17 months. Can you, make a deal with yourself to go for a short time? Can you bring a friend to the party? Can you, are there things you can do to make these things less anxiety provoking, so you can kind of just slowly reintegrate yourself? So those are some, those, I could go on about that because I think about that a lot. But
if you, I could go on listening. Do you have other thoughts on that? I'm sure that.
Yeah, I think that one of the most common questions I get from people emailing me or calling me in media is around this social anxiety and people feeling anxious about going out and doing things they used to do. And I think that other things, and there's some of the anxiety is around the virus, but it often goes beyond that. And it's really about avoiding situations that are stressful. So I think anything you can, so a couple of things is, one, anything you can do to reduce your baseline stress and anxiety level will help. So some of the things, so for example, if I know I'm going to give a talk that's making me anxious, I make sure I go for a run or try to work out earlier in the day, because that will kind of just reduce my stress level. And then when I go into the talk, even if I get anxious, I won't get as anxious. So doing all those kinds of things that take care of yourself. But then, like I said, the other things is getting support and things you can kind of reintroduce yourself to things in a slower fashion. So you don't have to go from being home all the time to going to like some huge party. Maybe the first step for you is like meeting a friend out, or meeting a couple of friends, or going to, going to like your neighbor's barbecue, or, doing something that feels a little easier. and starting slowly, and then you can kind of work yourself up to these bigger situations.
Jennifer, and you referenced this a little bit at the beginning of our conversation, had asked, is there anything, what can employees who are experiencing, what can be done to help employees experiencing this, in particular, anxiety transition in the workplace?
Great. I think that is a great question. Some of the things I've thought about are, one, having really clear messaging. So uncertainty and just like, uncertainty just breeds anxiety. So we can have really clear messages. Secondly is, I think, listen to employees, and where you can still get the work done you need to get done, but be flexible. Are there ways, if people feel like they have more control, that will reduce their anxiety? So that may mean, for many, many people, I think that means, it seems like the overwhelming, majority is something between, yes, we'll come back, but I can't go back right away to 9 to 5, 5 days a week. So where it's possible to listen to employees and make adjustments and allowances, do that. Because if people have a little more control, they will feel less anxious. And then I think if there are things your workplace did that seem to work, like some places offered, support groups, some places offered free subscriptions to different apps or different services. See if you can continue those, get a sense from your employees what was helpful to them, and don't sort of just pull them because we're back. And so I think some of those things that workplaces did that or tried to do have been incredibly effective, and it can also be useful in this transition.
This question comes from Bryce. Do you think one aspect of the pandemic is that there's an increased compassion for people who have mental health issues? Since many people may be experiencing things like depression and anxiety they may not have felt before. And if you do agree, then how can that compassion and understanding be kept going?
Oh, I hope so. I don't know. I hope so. I remember, I think it was last summer, last summer, Michelle Obama said in a podcast about how or an interview where she was experiencing a low level of depression. And my email blew up that day. I saw it posted on, news. And I think that, that kind of showed me how, having people talk about their experience, especially prominent people, influential people, can really give permission for people to share about how they're feeling. So I do think that it's definitely raised awareness, and I hope it's increased compassion, and that's a good question about how we keep going. I think one of the ways we can keep it going is continuing to have, to sort of not sweep it under the rug. Now that if we're in post-pandemic world, not sweep all of what we're experiencing under the rug, and especially keep coming back to national leadership. But it really does help to have people who are in influential positions, whether in policy, or in a social media sense, talk about their struggles. That does give permission for the rest of us to talk about it. So I think that is a positive, and I hope to see that continue.
Do you have time for a few more questions?
Yeah, sure. Let's keep going. All right.
This question's from Gita. Do you think that the pandemic will cause people to lead more of their lives, socially and professionally, online versus in person? And what might be the mental health consequences of that? Have you been looking at that?
Yeah, I mean, the people have been looking at that. I think we'll see. I mean, in our global survey of pregnant and postpartum women, we found something that's been pretty common, which is that there is an association between feeling more depressed or anxious and a high level of media exposure, whether it's news, social media, and that can be, that's one aspect of living lives online versus the sort of, Zooming or connecting. So I actually think that there'll be some positives in that facility with Zoom and or whatever different online platforms has enabled us to connect. I mean, I've connected with old friends, connect globally more easily, made it more kind of normative. And so I think that's some positives. I think that, but I also think it's shown people the limits of it. And people are craving that in-person contact. So I don't know that we will, it will shift to where people want to live more of their lives online. I think that actually it's shown people that they actually want to kind of connect in person and things like that. I think it'll be something we'll learn a lot about that over the next year as people study how living this virtual life has affected, many of us.
This transitions, and I'll wrap up shortly, from Jamie, and then I want to follow up with a question from Jack. How well does virtual services for things like mental health issues work? For example, accessing therapy and mental health online. And there's a follow-up from Jack, but I'll start with that.
Yeah, sure. So
because it's different, but
it is different.
Yeah.
Right. So there actually has been, there's been quite a few studies prior to the pandemic on whether virtual mental health services were equivalent to in-person for specific treatments for specific disorders. I'm familiar with those for post-traumatic stress disorders because what I study. And actually the evidence is that for many treatments, virtual can be provided as well as in-person. For when they looked at specific kinds of treatments. So a lot of that, surprisingly, I want to give credit, is led out of the Department of Veterans Affairs. There's been a lot of research out of that. Boston National Center for PTSD and Boston colleagues there, give them credit because in the VA, which is sort of its own healthcare system, there's been a big push to reach veterans who live in rural areas and could never access services in person. So to increase that access, they actually studied it and found that. So there is a lot of, it doesn't mean it's not for every disorder and every problem. It's not perfectly equivalent, but for many, many things it is equivalent. And there is some evidence that people come more if they have a virtual option, because especially for parents or children or young people, because they all the logistics of getting to an appointment. You don't have that. You think of, I live in an area where there's therapists everywhere. But if you have to drive an hour each way, you have to drive, you have to park, and a 45-minute therapy appointment becomes 2 hours between the logistics. So I think there's lots of positives about that.
This leads pretty well into Jack's question. Many people are trying to get time with a therapist who are finding it's super hard, and therapists are booked.
Yes.
Are there enough mental health providers to meet the demand? And if not, what can be done to bridge the gap? This was obviously a problem well before the pandemic, but.
Yes, it's been made. I mean, I know because for family members, but also just people contact me for referrals, and pretty much every provider I know of or have contact with, especially those for kids, are not only full, but their wait lists are full. Many, many providers are not, or have closed their wait lists. So I live in a place where there's a lot of providers. So I think we know the answer that there aren't enough, particularly enough that take any kind of insurance or are affordable. I'm talking about people who might not even take insurance and are, have market level fees. So even at that level, if you can just pay out of pocket, you're just willing to pay, people aren't available. So I think there aren't enough professionals. I think in terms of what we can do, there's some practical policy things. One thing is that people have talked about is allowing people to provide services through telehealth across state lines. So that right now, the way insurance works and licensing works, like I'm licensed in Massachusetts, I cannot provide services, even though if someone in Pennsylvania wanted services from me, I could not provide them, even if logistically it was possible over telehealth. So there's challenges to licensing and reimbursement that might help with some of this. And then the other piece is that really is, we had a mental health care crisis before the pandemic. So I have wondered if some of the models that have worked in other countries and contexts, like where I work in low income settings, where there are effective treatments and services that could be provided with people who don't have a master's in social work or an MD or a PhD. And are there ways to implement those better so that there's more providers, which is it's something that is done in other contexts, in other parts of the world a lot. Whether we could do something more like that here, whether we could look at things like peer supports, or are there services that could be provided through churches or other community organizations, which might be different. I'm not talking about someone who needs a specific medication that might need to see a psychiatrist, but many of the things that are effective for mental health, could be potentially provided by people without this, extensive graduate training. So, but they wouldn't be reimbursed by insurance at this point. So there's complexity there too. Sorry.
No, sorry to cut you off. Thank you for taking all these questions and running over. I just want to wrap up, as we think about this time in this kind of reopening transition in the US, globally, a more complex picture. What are your big takeaways right now? Your big kind of things, tools moving into this uncertain time, and also questions that you have looking ahead?
Oh, my big takeaways are, I'm wondering, I have the same, concerns and uncertainty, facing the same uncertainty as everyone else, whether it's what's school going to look like for my son, all that kind of thing. So my big takeaways are that it's really been amazing to see all the innovations and the attention to mental health in the past year in the public, in the media, how mental health professionals and organizations have stepped up, the amount of free resources out there. It's almost overwhelming. There's so many free resources, and the conversation around mental health. So that makes me feel incredibly positive that that's not going to disappear going forward, and it offers the opportunity to make real changes. And so, that's where I'm really hopeful. And I'm hoping that translates into institutions, government and institutions making some policy changes or thinking through policies that'll improve mental health going forward for everyone. We can think about, mental health as, COVID taught us that, the health, my neighbor's health and other people's health affects my health. How people behave, if people in my community are wearing masks and distancing, that can protect my own health. Well, it's the same thing with mental health. And if we can think of mental health as something we share as a community and not as something as it's just our individual responsibility, I feel hopeful that if we can do that, that will bode well going forward.
I muted because of the loud subway, but thank you so much for your time and for taking everyone's questions. That concludes our discussion. This Q&A has been jointly presented by the Forum at Harvard's T.H. Chan School of Public Health and the World from PRX and GBH. You can view the full discussion on the Harvard Chan YouTube channel and on our Facebook pages at Forum HSPH and at PRI The World. I also want to add, in this important conversation about mental health, that if you or a family member need assistance with a mental health or substance use issue, you can call SAMHSA's national helpline, 1-800-662-4357. There's also the National Suicide Prevention Lifeline at 1-800-273-8255. Thanks, everyone, for joining us today.
Thank you. Thanks, Elana. Thanks for your questions, everyone.